Taking on the medical establishment. I'm joined today by Dr. Mohammed Adil, who I had the great pleasure of meeting in early 2020. And we actually worked together to put on one of the first online conferences exploring the response to COVID-19. But today we're here in different circumstances. Now, 3 years on, Dr. Adil had his medical license suspended by the GMC in June 2020 for his work in speaking out against the pandemic response. However, still today, he has not had his license suspended. So he's taking the GMC to court tomorrow. He's in the Royal Court for Justice in London, taking the cause to the highest level. So, Dr. Adil, welcome to the Pandemic Podcast. It's great to see you again.
Likewise, Dan. Thank you very much for giving me a chance to meet you and to express myself regarding my prolonged suspension for nearly 3 years, and it's a great message for the public that I am going to the court for justice, and I'm standing for truth and integrity. So hopefully we'll win the case and make it history tomorrow.
Yes, well, you're a senior surgeon. You've had over 30 years in the NHS with an unblemished record. You're highly respected in your industry, both here in the UK and in your nation of Pakistan, where you've got a large network of other doctors and surgeons who you've worked with over the years. You've got an impeccable record, and here we are. The NHS has been struggling all winter, and yet someone like yourself is suspended. Could you tell us a little bit about what happened?
Actually, what happened was in the very beginning of year 2020, I was working as a consultant general and colorectal surgeon in one of the teaching hospital in Manchester, North Manchester Hospital, where the coronavirus was introduced in the first instance, and the way they portrayed it and they claimed about the lethality of this coronavirus and the extraordinary restrictions on the public. They were not supported by the science or by the research work at all. And at that time, there was a confusing research all over the world, and nobody could tell us what is the origin of this novel coronavirus, whether this was a natural virus or whether this was a man-made or this was leaked from one of the laboratory in Wuhan. And nobody was able to tell us about the pathogenicity, the mode of transmission, or the way to curb the spread of the coronavirus in a better way to protect and to safeguard the humanity. That was a very serious problem, and people got confused. They were living in a wilderness. There was a darkness everywhere. And I just try to alleviate the anxiety and distress and the hysteria of the created by the mainstream media to relieve the anxiety and the stress of the public, to support them. So in order to do that, I released a couple of videos on the social media to initiate a robust scientific debate with the other clinicians, scientists across the world, and the other researchers to work out what exactly it is and what is the best way forward to deal it. This is all about the research work and the advancement in medical sciences and innovation, because this is a key factor which I believe on, and also it is also my moral and ethical duty to safeguard public and the patients from this uncertainty and the hysteria they were going through. So, and you can imagine that just few days before, on 19th of March, the government downgraded the coronavirus as not a high consequence infectious disease, neither airborne nor the contact. Basically, the highly consequent infectious disease spreads two ways, but they were not sure which way is going to go. That's why they brought in the sanitizer. They brought in the social distancing, and they they created so much fear to the public that really caused a serious concern. So I released my videos and I reassured public that this is not as dangerous it has been portrayed by the mainstream media and the government, to alleviate their stress and anxiety, which was appreciated by many thousands of people across the world for their own benefit. So I had no personal interest to speak out. But unfortunately, no scientist, no researcher, and the medical establishment, they turned against me, and nobody came to start a scientific debate with me to safeguard the public and to have a better way out for protecting the public and the patients from the problem with the coronavirus. So that was taken very adversely. Instead of appreciating that, the trust dismissed me on 22nd of April 2020 without any warning, show cause notice, or any disciplinary procedure. And they asked me to leave the hospital. This is the trust where I conducted 2 international scientific conferences in June 2019 and in September 2019, attended by thousands of overseas delegates across the world. But they didn't give me a chance to express myself, that what I actually wanted and what I meant to do that. And they dismissed me, followed by, after 3 weeks, by a short online Skype hearing by the General Medical Council with interim order tribunal, and they suspended my license to practice for 12 months with the 3 allegation that they had complained by anonymous 3 members of the public, which never came to surface until today, in last 3 years, which I've been requesting to produce those witnesses who brought the complaint, but they refused to bring the complaint forward, and the complainants for their oath and their witnesses to prove the case, but they failed to bring those witnesses. And I had 3 allegations. One was that my videos has damaged the welfare of my patients, and secondly, my videos might have been damaging to the safety of the public and brought disrepute to my profession and the trust of public on the medical profession. But none of these allegations were proved at all, and nobody was alarmed. I yet to see anybody who has come forward to say that my videos on the social media have brought these damages to patients, public, or medical profession at all, apart from the General Medical Council, who were very much alarmed by that, and without giving me chance of having a discussion or in a remediation meeting or whatever their plan was. But I couldn't tolerate that insult with the patient, because all the hospital doors were closed. The patient were transferred from the hospital into the nursing home, and the health services were totally seized off. And that time the waiting list was 4 million. I remember that when I was working there. Now it has gone over 8 to 9 million, maybe more, which is not disclosing. And patients have miserable time in the accident emergency, and they are suffering a lot. And most of patients have gone into the private sectors. So this is and the millions of patients, they lost their opportunity for having their investigations and treatment, especially the cancer patients. As a scientist, as a researcher, and a clinician with 35 years of experience, I know that picking up the early cancer in a patient shows better result compared to the advanced cancer. But all these investigations and treatment as a screening programs for the cancer were abandoned. And at least 1,200 trials were abandoned in the country, and the country went into lockdown. which cause serious problem to the economy and the welfare of public, mental and the physical health issues, and that actually cause serious problem, which and people are still living. They are sick, they are not getting the medical treatment, and they're unable to see GPs. They wait for months and months to get a appointment with a GP, and seeing a specialist has become a nightmare. This is what I'm standing for. And I was, after 12 months of suspension, I had no clinical issue at all. This is very important for the public to know, that I had no clinical issue. I had no patient complaint. I had no ethical, social, or any a complaint from my colleague or patient, or any other. I mean, trust that I violated any medical ethics. Not at all. Only complaint was that I spread misinformation to the public regarding the coronavirus. That was all about.
I mean, this is unfortunately a very telling story of the times that we've lived through, and you were one of the first doctors to really take a stand early on. You were one of the first to come out and say what was happening. A part of a small contingent initially of doctors and scientists who were concerned by what they were witnessing, and you would say with ease now. I mean, you and I have spoken a lot over the years. We're on the same page, but looking back, you can see that the things that you've said have been vindicated. It's the problems that we're now facing today were predictable problems. Yet to say so was, just chastised, and in your profession now, you've had to take the consequences, not just of being unable to practice medicine, which obviously has a consequence on your own career, but also on your potential patients.
Absolutely. Yeah, I totally agree with you, Dan. The thing, I predicted that because of my experience and the scientific knowledge and the research for last 35 years within UK and abroad. I've been traveling for teaching and training, and I'm international speaker, recognized in different part of the world. I regularly traveled across the world to deliver lectures and for promoting medical education and advanced teaching and training in surgery medical ethics. So I stood on that. I couldn't keep quiet on what was happening in the hospital, because the hospital were empty, and the same were the intensive care units, and the patient, there were no patient there, and most of the doctors and nurses, they went on leave because of the COVID sickness or illness, and the services were totally seized off. And the mask, then mask, initially they said there is no need for the mask, if you remember that. So in our hospital, they said there's no need for a mask, and then they came and said we would need to have a mask. They were so much confused about it. Nobody came forward with a solid way of dealing with the crisis at that time, and there has not been any scientific robust debate among the clinicians, scientists, medical establishment, politicians, and the government before forging ahead for imposing so much restrictions on the public. So this is what I stood for, and I expressed my view in order to relieve the anxiety and the stress created by the mainstream media with the fear and hysteria, and that actually killed so many people across the world, not only in UK but also across the world, because same thing was happening all over the world. So I had a sympathy with the public as a human being, as a clinician. I am a lifesaver. I save lives, I relieve pains, and I treat my patients, and I love them. I had no complaint in my 30 plus years of career while working for the NHS in UK, and I did my work very honestly and diligently. And at this occasion, I could not tolerate the way the things were moving for the health services for the public. So I had to
Absolutely.
speak out, and I don't regret that what I said was wrong, because most of the things which I said has come out to be true at this time, because the waiting list has gone over 9-10 million, and the cancer patients, so many millions have passed away. We have no record for how many. At that time, out of 4 million waiting list, there were 1.5 million cancer patients were waiting for the investigations and treatment. I'm a breast cancer surgeon and a colorectal surgeon, and at that time, so many people were waiting, and we had a lot of patients have vanished from the waiting list, because they the cancers. So some cancers are so much rapidly progressing that patient cannot sustain so long for waiting for 3 years. And the same thing is going to be now. That's what we need to rectify, that to provide the best possible services to the public for in terms of their investigations and treatment. Everybody should be honored as they had 3 years ago. Because at the end of the day, the NHS is fully funded by the public money. It's not the federal government which control which provides the money. It's a public money, and why public should be deprived of for having their investigations and treatment, which is their fundamental right out of the 6 human rights. And
Indeed.
also,
So,
yeah,
Dr. Adil, you were initially suspended for your actions for 12 months,
correct.
but you still haven't been able to return to practice. So what
So,
happened after the first 12 months?
after first 12 months, I went. During those 12 months, I went through 5 different interim order tribunal meetings with the General Medical Council, but none of them was fruitful without any justification. Although I did any crime to justify General Medical Council to crucify me the way I have been. It looks like I've been picked up, targeted, and crucified for silencing the other medical professionals and the wider health community, so that they should keep quiet, to keep them silent. This is their mode of action. After 12 months, they got me suspended for another 12 months without any justification.
So
So,
you think they wanted to make an example of you as a warning shot
absolutely.
to
That's
other
why
doctors?
I
Yeah.
strongly feel that they have done extreme injustice against me, and my career and reputation has been totally lost, and I have been through serious financial strain for the last 3 years without having any income support, and or any earning at all. You can imagine, I have a family and children, 3 children. One of them is in the university, and the other 2 are in school. So I had to sell my home back, my inherited home back home, to bring money to spend on my children for paying their university fee, and then to educate my other 2 children, and my wife, she doesn't work either. So they just carried on. So after 12 months, they suspended me for another 12 months, and then they referred me to the Medical Professional Tribunal Services, which is a branch of the General Medical Council, but they pretend to be independent, but they're not. So I went through the hearing for 3 weeks, from 13th of June until 1st of July 2022, and I faced 6 members, including the GMC lawyer and the 4 members of the tribunal, and the other people inside, and on my own, because I didn't have any solicitor to represent me. So I just raised the question that what is your allegation. There are 3 allegations that my videos you had a concern about, and they could not produce any witness or any complainant who had lodged the initial complaint against me online, and they said that they are not available, whether they were existing or not, whether they were fictitious. If they were existing, why GMC could not produce those witnesses to prove their case? And then during this period, after 12 months, they walked into different trusts where I had worked for the last 3 years. They tried to collect any clinical material against me to reinforce their media alleged case. So but they couldn't find any serious issue at all, uh, apart from one minor case which they discussed in the medical professional tribunal meeting in 3 weeks, and they terribly failed to prove that. So there was no clinical case at all proved during that period. And then they tried to implicate me into a mental health issue because I was talking against the government narrative. So again, they failed to prove that, including their two assessors of the General Medical Council. Plus, I had four other health assessors. They said, "What are you talking about? Mr. Adil is a fit and healthy person. He's got unblemished record. He's fit and healthy, and he doesn't have any mental problem. Why you want to implicate him into a health issue in order to suspend him further or to erase him from the register?" So ultimately, with all these proofs and witnesses which were produced during that 3 weeks of the hearing, GMC failed to prove any evidence against me, to prove that I had any clinical issue, I had no mental health issue, and I had no. They could not produce any witness to come forward to say that my videos had brought disrepute to the medical profession, and nobody had turned up to say that my videos had damage to the public, members of the public or the patients. Neither they had proved any survey or any trial or anything among within the country to come forward to say that my videos had damaged the medical profession. So on that basis, I should have been acquitted with the apology. That's what I was expecting. But at the end,
At the very least, compensation for your losses,
absolutely,
for
3
lost
years
earnings.
for what? I mean, I've been. It looks like I was unheard and condemned for 3 years to make me an example. That's what you said rightly. So at the end of the 3 weeks of hearing, which even I went to the oath corner where I took the oath on the Bible, Holy Book of Bible, which I respect a lot. And although I was a defendant, it's not a policy or law, according to law, which I have come to know. I shouldn't have gone through that, but they put me into the oath corner to give an evidence, which I did. For 2-3 hours, they grilled me. When I said to the GMC lawyers, "Why don't you come and sit there in the oath corner and give me evidence that your case is true?" But he refused to come. And the chairman of the medical professional tribunal said, "No, no, no, he's not coming." I mean, it was just a cahoot with the General Medical Council. At the end of the 3 weeks, the chairman wrote the determination that Mr. Adil has got no clinical issue, no mental health issue, and no physical health issue, and he doesn't have any patient-related issue. But because of safety of the public, we are suspending you for another 6 months unless you come back, apologize with the General Medical Council, and show remorse. And you don't seem to have any insight or reflection at all. You have not learned any lesson, and you should come and give us a written apology that you will not do in the future. This was threatening. This is not a way
Absolutely.
in the civilized world, in a democratic society where we have the right to say. I exercise my freedom of speech and expression. I believe on my medical ethics. I believe, since I took my first job as a physician, I took my oath as a medical physician, or a Hippocratic oath, that first do no harm. Thanks God, I have not done any harm to any patient throughout my 35 years of career as a surgeon. I'm not counting the medical school education, 5 years, another on top of that. But I believe on Nuremberg Code, I believe on Helsinki's declaration, and I believe on the Geneva Declaration. I don't want to go into detail. People know it enough about that. But in spite of all that, I have been through this. I have no choice, because they further suspended me, and they wanted me to to confess that I've committed the mistake, which I didn't do any mistake. I just expressed my viewpoint, which did not interfere my clinical practice at all. I did it during the weekends or during coming back from North Manchester to Milton Keynes at the weekend, like we're doing this program. I just expressed my viewpoint. Millions of people are contributing their thoughts on the social media, and that should not be barred by anybody, because we've got the right of speech, we've got the freedom of expression and the freedom of thoughts, freedom of press and publication, as we're doing, freedom of broadcasting the program or to express your point so that public can hear. But public make their own decision. They're not going to be damaged with my advice or with my comments, because people are intelligent enough to make their own decision for their health or for their well-being. My point as a surgeon, as a clinician with long-standing experience, skills, and qualification was to enlighten the mind of the public that what I feel is the way it should go. And I had no obligation to follow the government instruction, because I myself am a scientist and I'm a researcher. I'm not less qualified than any of the government scientists, to be very honest with you. And I have my opinion. That's all about my research work and my qualification. So I give my opinion, which should have been respected there, what I'm saying.
Well, absolutely. If anything, it seems to me that the GMC are interfering in the medical scientific process to actually deduce the true nature of reality as it emerges, because, well, we know going back into 2020 that the science was established very quickly, and that was uncontestable, even though different evidence continues to emerge.
There was no evidence at all for the coronavirus at the time when they put the lockdown. 3 days ago, what they said was it's not a highly contagious infectious disease. And then after 3 days, they put the lockdown. And then in October, November, they rolled, remember we discussed about that, they rolled out the experimental, unlicensed, untrialed vaccine with full indemnity. So why they took the full indemnity? Did they know that it's going to do harm to the public? And public were given the injections of the vaccine without their consent. If public say that we have given the consent, I wouldn't agree. The consent is when we discussed about the method of treatment, whether it's a medical treatment or it's a surgical treatment or it's any new medication, we discuss with the patients. And before, within 3 months they rolled out the vaccine. But usually, as a scientist, as a researcher, I know the protocol. It needs at least 10 years to get the license of the vaccine, because it has to go through several trials, safety measures. It has to go through the testing before bringing into the market. But what was the rush of bringing the vaccine into the market within 3 months? The only excuse which they gave of this question, which I raised to the government, they say, "Oh, this was an emergency. That's what the national emergency. Why did you consider about all the COVID-related patients, and you've forgotten about the millions of the other patients who were non-COVID? They were cancer patients. There was a patient with the strokes, leukemias, patient with the diabetes, hypertension, and a lot of other patients who were waiting for the investigation treatment. They were non-COVID patients. You only concentrated on the COVID patients. And we haven't seen the flood of that patient coming to the hospital as it was predicted by, say, the group of emergency surgery in United Kingdom. This is my whole point, that it was untimely to roll out the vaccine.
Well, I think there's so
tested.
Yeah. I mean, there's so many issues that we could discuss throughout what's happened for the last couple of years. But I think the case that you've taken on here to take the GMC to court is an important one. Well, it's a pivotal one on the basis that we need to maintain the ability to challenge medical authority. We need to maintain the ability to have open science. We need to retain the ability for scientists, medical professionals to be able to put forth their own informed viewpoints. And this, regardless of what one may think about any of the individual protocols as a layperson, as a member of the public, within the scientific and medical domain, there should be the town square, the public square for such debate. But it's just been shut down, and people like yourself, like we say, has been made an example of. So what's happening tomorrow? Tell us a little bit about what's happening in court tomorrow. You're going
at 10 o'clock
to
is a hearing, Dan. Sorry to interrupt you. At 10 o'clock, there is a hearing. I just received a phone call from Mr. Philip Highland, my solicitor, who has been very kind since last 3 years. He's been supporting me. Same is the case with Mr. Francis Hoare. They have been very encouraging and supportive, and they know my case very well. And Francis Hoare has, Mr. Philip Highland has told me that the hearing might start at 10 o'clock. So I got to be there by 9 o'clock in the Royal Court of Justice Strands in London, which is close to the Embankment tube station. So it might kick off at 10 o'clock. So I would request to the listeners and the public and the supporters and the folks who have been supporting me throughout the last 3 years. I'm really grateful to all of them across the world with their kind words, with their donations to support me and my cause, and to come earlier, try to make it at 9:30, so that there might be a queue, because thousands of people are traveling from different parts of the world, including the scientists and the medical professionals who have been standing. Dr. Peter McCullough, who has recently won his case in America, similar case. He spoke against the COVID pandemic. He said this is a fake pandemic, and he said about the masking and the vaccination. And he went to the court, and the court has actually dismissed the case of the complainant, the regulator, and he has won his case. So he said he's also traveling from the United States to UK, and others from Germany and the different part of the world. So it's all day case actually tomorrow, and my solicitor and barrister both will be there. So I'll be there by 9 o'clock. I'll welcome all the guests coming, and it's a public inquiry, and everybody's welcome to sit and listen what's exactly happening. So hopefully, with your kind support, we will win this case to make history, because I've been treated brutally without any remorse, and this is not the way to deal the situation where I have been through.
Indeed. And what is your hope for tomorrow? The case is. What is your hope with the case?
It's crystal clear. I've not done any crime. I have not killed any patient. I've not done any manslaughter. I have not committed any sexual or any assault on any patient. I have a crystal clear record throughout my 35 years of my experience, and I'm a very good surgeon. I have not a single complaint, which is unusual for a surgeon. I've never been a subject of any questioning of civil or any criminal court, and I have a crystal clear record with the NHS and the General Medical Council, and I don't find any reason that I should not be reinstated, and the GMC should regret, and they should not. They should apologize, and they should not do the same thing again. They have actually gone beyond their powers. They are exploiting their powers, and they are using the public office to crucify the vulnerable doctors, which are usually the locum doctors or the overseas doctors like myself, to make an example to the wider medical community, so that to keep them silent. The other doctors have been speaking as well. For example, Dr. Steve James, he spoke again. He challenged Dr. Sajid Javed in King's College Hospital. He expressed his viewpoint. And similarly, Dr. Tess Lary and Dr. Sam White and many other doctors are speaking out. Why I've been targeted and treated brutally like that. That's why I have knocked the door of the High Court for the justice, which I have been crucified for the last 3 years for unnecessary and unwarranted reasons without having any serious issue whatsoever.
Yeah, indeed. I mean, McCullough's case that you referred to as a landmark case, and that your case here tomorrow is a landmark case as well. And wishing you the very best of success in the case. We're certainly rooting for you. You've been consistent throughout this period of time, and helped inspire many other doctors to actually have the courage to.
Yeah, that's what my message is, that nobody should be barred, including the health professionals, to speak out about their the medical ethics and which has been seriously violated for the last 3 years, and the human rights and the civil liberties have been totally violated, and which is our human rights according to Article 10, 12, 6. I've learned a bit of a law as well in the last 3 years. So I mean, the judiciary, I have great trust on the UK judiciary. They are very impartial and they would look into the case seriously. And my circumstances, what they've done, and my previous record, and I should be reinstated. And nobody should be barred to give its expression. We are living in a democratic society. We're not in a dictatorship. If they say that we are not having a democratic right, then that is a different thing. But we claim to be the champion of the human rights, civil liberties, and the freedom of speech and expression, freedom of religion and worship, freedom of security at workplace without any recrimination to any health professional, and the freedom of work without any color, race, religion, or belief. That's what I believe. And then I treat everybody equally, and I treat everybody as a human being, regardless of any of these things. And I expect the same thing from the regulator as well. So, but I seriously think that this has been totally unjustified and discriminatory and abuse of its power.
Indeed, and the ultimate reality is this: is that irrespective of your views on the coronavirus itself, the pandemic response, the medical interventions, the reality is none of these things would have actually impeded on your ability to perform surgery to the best of your ability. It has no bearing on your ability to perform
this
surgery.
is an extremely important point you have raised, Dan. During these 3 years, I could have treated as being a surgeon, being a specialist in breast cancer surgery, colorectal surgery, and laparoscopic surgery, the keyhole surgery. I could have treated thousands and thousands of people if I had been working. But people have been deprived of for their treatment with my abilities, qualification, and my experience, which is totally unjustified. And this is actually damaging to the public health rather than on top of what they have damaged me in the last 3 years. Damaged my career, they have damaged my reputation, and I lost my earnings totally. And I've been through a lot of financial difficulties. And a surgeon sitting at home, what can he do? So I could have been a useful person for the society, as I have been for the last 30 years. And this is a great, I think people have been in great disadvantage of holding me on at home, but not working.
You've essentially been treated as a criminal by your profession, which is just unbelievable.
That's what I've not done any crime at all, and I have not mistreated anybody, and I have been very honest and sincere to my work, which I always have been, and I will. But I just want to express my viewpoint to the public across the world that look, this is if this can happen to me, this can happen to anybody. Let's stop it happening. and people should not suffer from the treatment and their investigations, which they deserve to have, which they're entitled after paying the heavy amount of taxes to the government. Why 10 million people are on the waiting list? Why people have to wait for 36 to 48 hours in A&E on a cold floor and waiting for a doctor to see just for paracetamol and cough syrup? Why they are unable to see a GP for months and months? Is it justified? It's not justified to my understanding. That's what my honest opinion is. There could be a better way to deal with the health crisis, which is one of our fundamental rights.
Indeed. Well, Dr. Adil, best of luck to you tomorrow. Please do share your support by attending at the Royal Court of Justice tomorrow. The case likely to begin around 10 a.m. So get down there early to support with other doctors, surgeons, and members of the public, concerned citizens from around the world. This is a landmark case, and it's a privilege to speak with you again and to support your endeavors. It's so important that people like yourself have the courage to take on the medical establishment. Ultimately, it's the medical establishment that has been unjust over the course of the last few years, and this is a chance for justice. So I'm wishing you the best of luck, and once again commend your courage and everything that you're doing. And yes, sorry to hear of the challenges that you've been through. Now, I'll say to our audience in closing, thank you so much for watching this. Please do share this broadcast this live today with Dr. Adil. It's today, Tuesday, Valentine's Day, Tuesday, the 14th of February. Please share the love by sharing this podcast. This is an important cause. This isn't just about a conversation. This is about action, and we need to support doctors like Dr. Adil, who has worked tirelessly over the last couple of years without compensation in order to be able to advance a message of medical freedom. So please do share this podcast. And if you're not yet part of our movement, please come and join us at weareelevate.org. Come and join the Elevate community. We will hear more conversations like this one, plus find out how you can get involved in other actions tackling issues just like this one. So thanks again to Dr. Adil, taking on the medical establishment, NHS doctor of over 30 years, unblemished record, who had his license suspended by the GMC. Tomorrow in court at the Royal Court of Justice, taking a stand for everything that's happened in the last few years. So best of luck, Dr. Adil, and thank you to everyone for tuning in today. My name's Dan Astin-Gregory. This is the Elevate Podcast.
Thank you ever so much, Dan, for giving me a chance to express my viewpoints to the public. And thank you for your time, and I really appreciate that.